Development, use, and evaluation of the OCPP resources directly underneath the management. We work with other faculties in psychosocial science and healthcare, like Sylvie said, with different partners from the University of Montreal and other universities. So we have a mission that is to transform the relationship that we have been speaking of today. So to get to a point where we have an egalitarian relationship between patients, professionals, and managers by changing the attitudes and bringing new skills with the patients and the professionals as well. And our mission is to give tools so that we can do that. So we're raising awareness with managers, clinicians, and patients, but they say, okay, but how are we going to do this? So this is what we've been doing in the last 5 years, is to develop tools and to make them accessible in the healthcare network. So you can see here the Office of Collaboration and Patient Partnership, and they work simultaneously in the last 5 years on actions in education, care, research, and there are two major characteristics of our interventions. We always work together, patient and healthcare professional, to be able to help guide projects, help build them and elaborate content. There is not one single tool that has been produced without cooperation and without co-construction, but it takes a lot of awareness, and we have to be very careful. Oh, I'm going to do this myself. It's going to be quicker. No, I forgot to consult the patient. So it's still sometimes difficult to have that a way of doing things after many years of working alone. So in all three sectors, in education, we have developed the notion of co-tutoring for patients and professionals together. So in all classes that talk about interprofessional collaboration, we work in partnership with co-tutors. And so in terms of care in our healthcare establishments, we're trying to work with something called the TCPP, the Tandem of Collaboration between Professionals and Patients, that is going to do actions jointly and in research. Vincent has done great work with research institutes in healthcare in Canada that will now include in their research patients that are also researchers and in their whole governance structure of the RSC. So very interesting and important changes. So if we look at what we have accomplished in the last 5 years since 2010 is to really raise awareness in social service establishments and to continue this partnership of care. We've worked in 30 health and social service establishments by our classes in cooperation and partnership with the patient. Every year, cohorts of 1,500 students, 14 healthcare programs are trained in partnership and including continued mentoring with patients for many months. 8 CHR networks will deploy our strategy. Partnership for Strategy and Research, and recently Dr. Antoine Boivin has obtained a chair of research on partnerships between the patients and the healthcare providers and the public. So before getting into partnership, we really have to raise awareness by conferences, workshops. We've spoken to more than 30,000 professionals and managers of healthcare and social services, and I'm always talking about this partnership. So yesterday I had a rep from a pharmaceutical company with whom we were speaking, and I learned that he has an illness for which he can be a partner patient. We gave him a card and he's in. So you see, that's what we're trying to do. We're trying to move forward constantly and raise awareness. And what's very important is recruiting patients who will work with us. We have more than 350 patients who were recruited, trained, and who are accompanied in their role, and they play very important roles. So for us, this is the heart of the center of what we do, and we've developed a lot of tools to share knowledge, because our objective is when we have an intervention, when we intervene in a healthcare environment, and the person who we intervene with can be completely independent in the way they do things. And so we accompany them for 1 or 2 years, but the patient ambassador, the patient who is participating, should be autonomous. And Marie Pascal joined us in research, and there are other researchers, and we are starting to publish our results. And so in the fall of this year, we will open our first school for partnership in health, and a intensive session of 4 days that will happen, where the registration will be in teams, a professional and a patient, and for 4 days they will develop a concrete project for their organization. That's the first part. The second part is our team will accompany the establishment in this transformation so that it becomes operable, and so that they can work in a correct way. So the continuous improvement in the quality of patient partnership in care and service design that Sylvie has seen, we've seen this in frontline care, specialized care, rehabilitation. We've seen this with patients of all ages from 20 to 88 years old, and we include natural helpers, parents, children, and St. Justine and neonatology. So the partnership is at all levels and all ages, and we can mobilize patients who will be involved. What has really touched me the most is a woman who is 80 years old, who has made changes and has helped an old folks home completely change their process and the way they do things at this old folks home where she was. So this little duck here is telling me that my time is up. And so what I want to tell you, to leave you with, is that our newborn is the tools to establishments by OCP Sustainable, and the tools on partnership and sustainability, where we have tried to develop skills that are common for patients and clinicians and professionals. And our education in the University of Montreal, the teaching will be built on these skills, and we hope that it will be able to be useful for patients so that they can be so they can develop as partners. And so that's very important for us, and we have a whole range of tools that are available now that you can use. And so there's a website also where we share documents and information, and it allows us to transfer documents produced by healthcare establishments to others who can take advantage of their experience, and so we can accelerate partnership. So that's what I had for you today. I still have a lot of energy. I hope my professional marriage will continue. Vincent, hold on to your hat.